As part of our COVID response, we knew it was important to maintain as much medical care as possible during the COVID pandemic, and as we're shutting down a lot of services to decrease traffic and make sure everybody's safe, telehealth became an avenue that was ideal for this situation and something we had already been working towards being able to provide to our patients. So the virtual visits allow the patient care to be delivered through video visits, through telephone visits, and that type of communication without requiring the face-to-face. As we know in the COVID pandemic, that close contact with individuals was the highest risk of potential transmission of illness, and so video visits really catapulted to the top of the list of how do we provide care to patients needing it, because all the other disease states that we take care of day in and day out don't stop. They just kind of took a back seat to the initial coronavirus situation. We started talking about cases in the United States, and there was a growing concern and looking at options for, as this got closer to Knox County, how we're going to address the situation here locally. And video visits was in the initial discussion with telehealth. Is we're going to have to be able to provide that in a rapid fashion. So really what we had set as a 3-year strategy to be providing about 100 visits virtually a month was in place in 3 weeks. So over that course of 3 weeks, we were providing well over 100 visits each day. And throughout the COVID situation in April and May, we provided March, April, and May, about 2,000 visits virtually, and now we continue to do that today, because really it makes sense for a lot of care being delivered, even not in a pandemic response situation. So a lot of effort, information systems, our operations management team, our providers getting on board with training, educating to the public and how to access the service, all went into that in a very short period of time. I think it's important to know that Good Samaritan has been the leader in healthcare in the region. We work very closely with the health department in making sure that all of the steps we're taking are the best care that can possibly be delivered to our patients and the safest for our healthcare team to deliver that care. We meet daily during the pandemic response as an incident command team and planning for all things from how care is delivered, how people will come into the building, screening stations, the virtual care that we've discussed, all centered around providing a safe atmosphere for healthcare to continue during this time. I think that I learned, you can get thrown a lot of curveballs, adversity, and being able to look at innovative ways. And so sometimes you think it would be cool if, or it'd be nice if we could do this, and it's kind of how are we going to get there, and then put in a situation where, okay, we have to do this tomorrow. You're able to respond to that, so was able to do that. And then organizationally, I thought that the team really came together, and the team being everyone, not just incident command team, but everyone involved. We had a number of employees that stepped up and took on different roles. We had a number of employees that worked from home, and that completely moved their cheese. We had the virtual visits, that having providers that are used to face-to-face interaction with employees or patients that had to look at, okay, how am I going to provide the same level of care in a new way? And that's an important piece of virtual visits that I didn't mention, is with Good Samaritan, we didn't outsource this, and we didn't contract with a third party to say this company is going to do our visits. It's the same providers that provide excellent care to our community every day, and that you go into the office and see. So there's a real continuity with that. But organizationally, the overall response, everybody was engaged. Everybody took on different challenging roles, and it was during the time you don't really think about it, but now as we're able to reflect on that, that was one of the bright spots that Good Samaritan really stepped up, and it's been a very good experience in the community. I have a number of individuals that come up to me and really thank Good Samaritan for everything that we've done during this time, because we've been the primary resource for information and for being able to give direction as to how people should respond.